All right. Okay, and we are live. Okay. Good evening, everyone. Good evening, everyone. All right. Good. Let's look at the intro video first. All right. Okay, hi, and we are back. All right, good. Let's just, yes, if you have any questions, okay, do put in the comments below. All right, I would love to share my dental knowledge with you all. All right, good. Good evening for everyone. Okay, good evening, everyone. Okay, I'm currently here in Singapore. Okay, and this is about evening time, 9 p.m. All right. Oh, good. I'm doing a Facebook Live to share my dental knowledge. So if you have any questions, feel free to let us know in the comments section below. All right, good. Oh yes, and for everyone in the community, okay, I have just an update. Okay, and I am planning to get a book out. Okay, that's why I have make some arrangement, and you can check out the post. Okay, so I'm planning to get a book out. So if you're keen to get the book or just express your interest of the book, you can look at that post and actually put down I want, so that I can gauge what is the appeal or what is the demand for the book, so we can estimate how many books to print. It's still in the writing phase though. Bear with me. All right. If you're keen in getting a book, you can actually check out my I think some earlier posts that I've done today. All right. And good evening to everyone. All right. If you're new here, okay, my name is Dr. Tristan Pei. Okay. I didn't put it here. Good. All right. Good. I think you all can hear me better now. All right. Okay. Good. Good evening, everyone. All right. If you're new here, my name is Dr. Tristan Pei, a Singapore dentist with 16 years of clinical experience. I have keen interest in wisdom tooth surgery. All right, and also in sharing my dental knowledge online with everyone. All right, good. Okay, if you are here, do type in hi. Let me know where you're watching from. Okay, we have lots of friends from all over the world. Okay, we have main bulk of people is actually in Singapore, but we're very happy to have lots of people in the community. Do share with us any dental questions. It might be concerning you, it might be concerning someone in the family. It doesn't matter. It's good to bring it up. We want to keep this session as casual as possible, and so that it's a way that we all get better in our dental knowledge. So with better dental knowledge, understanding, hopefully we can all have better dental health. Okay, and healthier, build more beautiful and awesome smile. All right. Okay. If you're here, okay, if you have been here looking at a post or experiencing the Facebook Live, looking at all the videos, if you like what you have I've shared with you so far, do give me some likes. Okay, love or wow. That will definitely motivate me to share more. All right, it's always interesting that we have interactions, okay, within the audience, okay, and myself. It's really an experience talking to a screen, okay. I am still working on it, okay. It's just that you're already talking to a screen and trying to have some interaction. So when you type something, actually I can interact with you all. Then I think it'll be more fun. All right, okay, good. Okay. So yes, we have a few friends coming in already. Jeff is here. All right. Tranza is here. Hi, Tranza. Good. Let's have a look over here. Okay, we have some questions. All right. Good. Okay. Yes. Good evening, everyone. Okay. If you're watching live, if you're watching this live or watching on replay, do let me know if you have any questions. Okay, today's sessions, we also want to keep our sessions, we want to hold on our timing a little bit more tighter. I think yesterday we actually had a 1 hour long session. So today I think we'll limit to maybe like half an hour, 30 minutes. So we will end everything at 9:30. All right. Oh, good. Oh, good. So all right, good. Let's look at some questions here. Okay, good. Okay. Yes. So we are actually coming live. All right. Recently, been actually a lot more busy in the dental clinic. Okay. Recently, I've been a little bit more busy in the dental clinic. I have actually lots of dental questions. Lots of dental questions in our community. They're all in our posts, in our messenger, and I would love to answer every and each one of your, because as a dentist, I understand that dental pain or dental discomfort is not something that any patients or any friends would like to have. I would love to answer everyone, but sometimes it's really not so possible to actually have me to actually go down. I mean, I would love to answer everyone, but there's so much information, so many questions out there. So I'm doing my best. Also, if you want your question answer actually faster, it's actually still coming to Facebook Live. You can key in your questions, then I can answer you. All right, that's actually the fastest way. Okay, and yes, in the clinic it's a lot more busier now. After this, in Singapore we have instead of this thing called a lockdown, we actually have a circuit breaker. So we have just passed about 1 week after our circuit breaker. Okay, so in a sense, we just finished our lockdown. And dental clinic activities are getting to be a little bit more normal. Not the full-fledged, but we have some breaks in between, and getting a little more and a bit more busy. So recently, I also have a lot more inquiries on the wisdom tooth surgery and on the procedure. Also, been very busy in the clinic. Thanks for understanding. I try to load more interesting videos for everyone. All right, good. Let's just answer some questions here. Okay, good. Let's go to our question. Hi, Doc. What is it that make my teeth painful every time I eat something sweet? All right. Okay, if you eat something sweet, okay, and it's painful, this usually is a form of teeth sensitivity. All right. Our teeth actually has 3 layers. All right, enamel, white, dentin, and the nerve. Okay. Let me see whether I can pull up the image. Teeth. Yeah, teeth anatomy. You see. Okay, I just pull out image. Then easier for me to explain if I could. All right. Okay, let's see. Share screen, Chrome. Okay. Actually, not this one here. Anyway, I just copy and paste here. Okay, good. All right. Okay, good. Okay, so if you're looking at okay, let me just scroll this a little bit more higher. Okay, good. Okay, so if you're looking at what actually causes our teeth sensitivity, or if you take anything sweet, understanding the tooth surface will actually give you a better idea why sensitivity or discomfort occur. Our teeth has actually 3 layers. The first layer is enamel, second layer is the dentin, and the third layer is the nerve. The enamel is usually enamel is one of the strongest material in our body. All right, and if you look at it, top surface usually is fine. However, sometimes enamel or the tooth surface can be lost through either teeth grinding, over brushing, or maybe chewing on very hard food. Or sometimes when we chew on very hard food, part of the tooth actually chip off, or when we grind our teeth, the surface of the tooth actually worn off. Also, when surface of the tooth worn off, then the enamel is gone. Okay, when the enamel is gone, all right, then we have the second layer dentin that's exposed. Also, if we have wear on the top surface, now the dentin is exposed. Dentin has dentinal tubules, and these tubules will actually link to the nerve, giving us a sensation of discomfort. It's something like an alarm system. All right, when we have some discomfort, our body is telling us something is not right. So if you know something is not right, primary care, what you can do at home is you can either you can brush your teeth well, floss well. Of course, you can use Colgate sensitive or Sensodyne toothpaste, any toothpaste for sensitive teeth. And if sensitivity still persists, always good to see your local dentist or dental clinic. Or if it's a cavity,
or if it's a cavitation or wear surface, you can either get the filling or a mouth guard. This is a solution if it's on top surface. In some cases, when we brush very hard, you see I'm pointing at the side of the gums now. So when we brush very hard, this part of the gum can actually string. When the part of the gum, can you imagine that this gum actually string down? Then we have this area here on top, which is a crown. Okay, we actually have enamel covering it, but anything below, we only have dentine. So dentine, the second layer is softer. If you brush harder, it actually wear off faster. And this area here can be very sensitive. So in the event, if you brush very hard, most important is changing habit. Use a soft brush, don't use a lot of strength, gentle forces. I think that's the most important. And when you brush, don't saw your teeth. Always go 45 degree, get bristles into the area. The best brushing technique is the buzz technique. I've actually included the link in our video, okay, in our comments in the description of this video. You can go and check it out on buzz technique. That will actually help you to clean better. And of course, what else are we looking at here? Yes, if the gums has gone down, sensitivity, the way to reduce sensitivity is either to cover up the area. We can either use a filling to replace the surface that's lost. Okay, we can also do crowns, okay, or root canal treatments. Usually, that is a little bit more, a bit too much. We always prefer something more conservative first, which is filling. But if there's a need to, we can always look at root canal treatment and crown. You say advertisement came out already. All right, okay. Good. So this is what we are looking at here. Okay, I hope I answered your questions. Okay. Good. Rita. All right, good. Hi, Leah. Nice of you coming back here. Okay. Okay, good. All right. Okay. Good. Hi to everyone for Bowana. Okay, Bowana. All right, good. Okay, another questions here. All right, my daughter have hole in her teeth, and what is the way out, please? All right, let's see. Okay, let me just. Okay, hole in the teeth. All right. Okay. So your daughter has hole in the teeth, and what is the way out, or what is the thing to do? Okay. So if your child, okay, has a hole in the teeth, you might want to help him or get him to clean the area better by brushing and flossing the area. It's also good to use the mouthwash. Only use the mouthwash only if he or she is able to speed up the mouthwash. Okay. And of course, if mouthwash is not readily available, you can also get you can also use warm water and dissolve salt until it's saturated and use it to gargle. That's also another way to look at. Of course, if the discomfort persists, okay, usually if there's a hole, okay, always good to cover it up. At the earlier stage, you can always do something simple like a filling at the dental clinic. So good to see your dentist. To get early treatment, will still be covering up with a filling, something simple. If we come to a later stage, sometimes we might need to look at root canal treatment and crown, or sometimes removal of the milk tooth. We would like to avoid that if we could. Of course, prevention or how to stop tooth decay for little one is brushing with fluoride toothpaste twice a day for at least 2 minutes. For the little one, okay, for the younger one, when we use fluoride toothpaste, the amount of toothpaste we use is it's actually this amount called a smear layer. All right, a smear layer is actually good enough when they are very young. Very young means when they are not able to speak. Okay, when they are baby stage, smear layer is good enough. When they are able to speak, you can actually use a P amount. What is smear layer and P amount? Okay, smear layer. Okay, smear layer toothpaste. Okay, I mean. All right, this image will tell us. Okay, Ken. Okay, so when we look at this, okay, this is basically the smear layer when we're looking at the smear layer, this is smear layer when we are looking at the children that they can't actually spit out, then always good to use a smear layer of toothpaste. When they are able to spit out, we can actually use a pea-sized amount of toothpaste. We always prefer fluoride toothpaste, while fluoride actually has helps to protect against tooth decay and also make the teeth stronger. So that's the reason why we will suggest fluoride. In some countries, some countries, they feel that fluoride is not so ideal, so they are more in the school of fluoride free. Nothing wrong with that. I think nothing wrong with that. It's just up to there's really a lot of there's a lot of different opinion on that. But from the dental point of view, from as much as we know, from the dental or dentist community, usually we will still prefer fluoride toothpaste because that can actually strengthen the teeth and also prevent tooth decay. All right, all good. So of course, anything excess is not good. If you actually use this for a little child and they're not able to swallow, then of course, end up we have issues like fluorosis, fluoride issues. So if you know how to limit the amount, actually fluoride toothpaste is the one of the best for care. All right, good. Okay, let's see now. Okay, good. So all right, okay. I hope I answer your question. All right, Favor. Okay, good. Let's just pop over to the other side. Okay, good. All right, good. Okay, we have a few people coming in here. Let me just freshen up here. Good. All right, so let's go to our next question here. Okay. Okay. Hello. Okay. Hi, Valentine. Yes, good to have you here. All right. Good. All right. Okay, good. And Li Jie, okay, I have hole in my teeth. Okay, and I've been pinning for more than 1 year now. Oh my gosh. All right. I'm sorry to hear about that. So obviously, if there is something that's bothering you, okay, I'm sure you have done something. All right. For pain relief, you can take painkillers that will help to control the discomfort. But 1 year is really quite a fair bit. So usually discomfort means that something is not so ideal. So always good to, if you can actually solve with painkiller, antibiotics, that's great. But if the discomfort still persists, always good to go down to your dentist or dental clinic to have a good look. An early phase of treatment will always involve removing the decay in the hole. Okay, decay in the hole, then after that putting a simple filling. That's the early stage. Okay. However, if the decay goes deeper, go into the nerve, sometimes we might need complex procedure like root canal treatment or even crown. And if the decay is so deep that we can't even look at saving it, then we might even look at removal. So early treatment is still the best. Okay, but of course, the fear of going to treatment is very reasonable. So why do we sometimes don't want to go or hold for 1 year? One of the main reasons is still the fear of seeing a dentist. Actually, I've done a video on how to overcome fear to visit your dentist. You can actually see the links in the video description later. All right, and in this sharing on how you can overcome fear, we actually share some of the useful tips. Like you can actually bring friends or family members along. That will actually help to to give you a little bit more moral support. And also we can listen to some audio from your phones, all these things. That's also pretty good. Also have some signals with your dentist. All right. So yes, good to see your dentist to get it sorted out. All right. Good. Okay. 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 Leah also asked, what actually caused tonsil stone? All right. What actually caused tonsil stone? So tonsil stone. Oh, okay. Let's see. Okay, tonsil stone is interesting. Actually, I also received quite a few people asking about this tonsil stone. All right. Okay. So actually, if I can show you image of tonsil, should I show you image of tonsil stone? Maybe not. No? I think it's not so. Yeah, it might not be so nice. Okay, and yeah, okay. So basically, tonsil stones are actually calcium deposits actually that form from small cracks in our tonsil. This occurs due to a buildup of food particles, mucus, and also bacteria. They appear as white or sometimes yellow spot at the tonsil, which is right all the way to the back of your inside your mouth. All right, you can try to brush it away or use a water flosser to help loosen the tonsil stone, but be very careful. Sometimes when you free the tonsil stones, it can actually fall towards the back of the throat and cause coughing. If you're in doubt, always good to see your dentist or dental clinic for good advice. All right, good. Okay, so Leah, I hope I answer your question. Okay, if you're like what you're hearing, please give me lots of likes, laugh, love, and wow, and that will motivate me to share them more. Oh, thank you. All right, good. Okay, and let's just move on. All right. Okay, Doc, is there any chance to remove cavity? If there is a tooth decay, then how to remove cavity is to remove the decay. It has to be in a dental setting. All right, and after in a dental chair, the dentist will remove the decay, and after that, we'll cover it up with a filling material. Of course, that's also one thing. In order for cavity to form, okay, let's see. The surface initially will weaken, but as long as if we sometimes do see initial decay, and the initial decay hasn't caused a cavity to form, we can always do some reverse or preventive work, meaning fluoride therapy, to actually help to mineralize the tooth or the part that's not so ideal. So at the dental clinic, if they notice some area that it's prone to decay, they can actually apply fluoride therapy that can help to mineralize the tooth and prevent a cavity from forming. So nothing beats still brushing twice a day, flossing once every night. With good habits, actually we can prevent a lot of issue. All right. So I hope I answered your question. Melissa. Okay. All right. Good. Thank you. Okay. Okay. Adib Samson. All right. Okay. My teeth are shattered. All right. So anytime I eat something, okay, my teeth are shattered. Okay. So anytime I eat something, it gets stuck to them. Leaving them in causes toothache. I can understand your situation. So and picking them always cause gum bleeding. So you're caught in a dilemma. When you clean, it start hurting you. When you don't clean, it start giving issue also. Don't clean, it start toothache. When you clean it, it start to bleed. So what you decide to stop eating meat. Oh my, all right. But I can't think of that forever. Of course, modifying habits is one thing that most people do when they have discomfort on one side of the jaw. What they do is they stop chewing on one side, they chew on the other side. This is never the solution. By actually modifying your food intake, that somehow also affect our quality of life. So I wouldn't encourage you to do that. So what can we do? Okay, from starter, let's look at what you can do at home first. All right. So when you're home, okay, if there's no pain, good. Okay, then you don't need to take any painkillers. If you need to take painkillers, always good to check with your dentist or your medical doctors to see whether they have any drug allergy. All right. So so at home, okay, pain relief, if you need to, you can take for pain relief. Okay, the second thing is brushing and flossing the area well. Okay, so when you brush the area well, what will happen? It will bleed. Okay, if it's bleeding, means you are cleaning the area well. All right. Sometimes when you touch certain area, it's bleeding, and when the gums are sore and red, when you touch it, of course it will bleed. Why? Because you haven't been able to touch it for a long time. Imagine if you don't touch it for 1 day or 1 week, okay, of course, bacteria, food trap at the area tends to be a lot more. And when there's a lot of bacteria, the gums tend to be a lot more sore and red. So when you actually clean up the red area, the gums will tend to bleed more. And when it bleeds, and that usually scare the shit, scare us lah. So it actually scares us quite a fair bit. All right, and when it scares us, usually what we do is we actually avoid cleaning the area. So the right thing to do is if you brush the area well, or when you floss the area well, if it's bleeding, keep cleaning it, but gently. Keep cleaning it, and when you keep cleaning, what happens? It will go down. But usually, most people when they see bleeding, they are very shocked. Because sometimes it reaches the stage where the bleeding is quite a fair bit. So it's very normal to be uncomfortable. So if you are comfortable, clean it gently. But if you feel that the bleeding is really too much for you to manage, do go to your dental clinic, see your dentist, and then they can actually do a cleanup for you, control cleanup. They can clean everything up nicely. Of course, that during that appointment, there will be a fair bit of bleeding. It will bleed like this, okay? And every night when you clean, after that appointment, it will still bleed, okay? And when you brush and floss, it will still bleed, but it will go down. So after 1 to 2 weeks, usually about after 1 week, you will see the improvement. So just be very patient. All right. So same thing for flossing. If you floss the first time, it will bleed. If I talk about flossing, I remember when I was a long time ago. Okay, that I was in dental school. That was when I was in as a dental student in year 2. Okay, I've never done flossing before. That's actually the first time I flossed, and that was actually when my Professor Grace Ong, okay, Prof Grace Ong, actually before our preclinical, before we start seeing our patients, they also want to make sure that we have good oral hygiene, oral health. So we need to brush well and also floss well. So we have to start habits of flossing. All right. So when we start flossing initially, I noticed a lot of bleeding. Of course, within our group itself, we have all this. We done the cleanup for ourselves. Then after we're done with that, then we'll talk about flossing. So the first time I flossed, it took me 1 whole hour. All right. So for everyone who haven't flossed before, or if you just started flossing, if you took a long time to floss, that's very normal. But with practice, you will get better. So just be very patient to clean the area. So it took me an hour, but over time, everyone will get better. All right. Oh, good. So yes, good to see your dentist. Let them have a look, okay, and solve the issue, okay, and that will actually help. I think that's the best thing to do, to go to the dental clinic. All right. I hope I answered your question. All right. Thank you. Good. Okay, good. Hi, doc. My gums are sore. What can I use to ease the pain? All right. So if the gums are having discomfort or soreness, to ease the pain, of course, it's painkiller. All right. Check for allergy. Okay, no allergy. Good. You can take the painkiller, paracetamol, or you can take a Profen. Or these are the things that we're looking at here to ease the pain. And also, one thing you can do, you can use a mouthwash. Okay, if the gums are sore or inflamed, a mouthwash also helps to clean the area. Mouthwash is actually a chemical way of cleaning the area. The mechanical way of cleaning the area is actually, these are the two ways of cleaning: chemical and mechanical. Chemical way is actually using a mouthwash. Mechanical way is using a toothbrush, a dental floss, okay, interdental brush, or water flosser. These are all mechanical way of cleaning. So if you can do this two way, that will help to clean the area well. All right. Okay, good. I hope I answered your question. Okay, and by doing this, it will get the gums better. If it's getting great, better, good. If it's not, do see your dentist for management. All right. Okay, good. Okay, let's go to the other side. Let's see whether there's any questions so far. Okay, that's good. All right. Okay. Hi, Jeremy. Okay, Jeremy is watching here. Hi, Jeremy. Good. Nice of you being here. All right, good. And hi, everyone. Okay, if you enjoy what you're watching so far, give me some likes, some interaction, some likes, heart, or just sometimes when I watch live videos of my friends performing, I like to spam the like button, spam the like buttons and or love button just to have some fun. If you want to, that's great. If not, it's okay. Just all right. Good. So what else are we looking at here? Okay, let's see whether any questions are. Okay. Have you answered your question? Yeah, correct. We have answered this question already. That's good. Okay. All right. Good. I think we have answered all our question. Okay. That's good. So okay, if you're watching here live, all right, or replay, I thank you all for being here. Okay. Awesome to have the community here learning. I will love to answer all the questions. I'll find time to go and answer your questions. If you haven't answered your questions, bear with me. All right, I really will find time. Thanks for your understanding. Because in the dental, now after the circuit breaker, it's actually very busy in the dental clinic. I'm also trying to find time to do live. It's also not so easy. All right, thanks for understanding. Okay, so everyone, if you feel that you learned something useful today, please help me like and share so that more people can benefit from this video. Okay, and if you can share it to your profile, all right, if you could, that'll be great. If not, you can share it to 3 other Facebook group so that more people can benefit from it. All right, so if you're watching it on Facebook, you can go to my page, click like, go to following, and select see first so that you will not miss my future videos and posting. So, and also do go to my YouTube channel and subscribe to my channel and turn on notification for future videos. All right, I've included the link, all right, to the YouTube channel and also to the Facebook in the video description also. So if you're watching on Periscope, please give me lots of love and follow me. All right, thank you everyone. Okay, and good night. All right, thank you everyone and good night. I'll see you then. All right, thank you. Bye bye.